Well, we're here with Dr. Fong, a dentist in San Jose, California. Good morning, Dr. Fong.
Good morning, Helmut.
Dr. Fong, tell me a little bit about your practice because, different practices are different. Even though to a certain degree as laymen, all of you guys have a dental diploma and a dentist is a dentist is a dentist. And at the same time, we're quite worried that they are different. So tell us a little bit what a patient can expect in your practice. Like, are you a typically like family practice where you deal with children, with older people, you do the dentures, you do some implant, you do, the functional dentistry? Or are you, kind of like, what about if somebody comes in who wants a Julia Roberts, Tom Cruise type of smile? Can he get that? Give us a little. In fact, Dr. Fong, why don't you please also tell us what made you becoming a dentist?
Well, let me first start off by telling you that my practice is a family and cosmetic dentist practice. I see children as young as 2 years old, and my oldest patients have to be 94 years old. I have two ladies who are 94 years old in good health, have their full set of teeth, and so I'm able to take care of the full range of children to senior adults.
Beautiful.
In my practice, we believe in personalized treatment, so each person is taken care of based on their needs and what is able to make them comfortable in coming in to see us.
Okay. So obviously you do the full range, and it's quite funny. It's quite funny that those two ladies you have who are 94 years old and have a perfect set of health. I have heard it many times that long age with still life in it also, not being a vegetable and old, but long, a vigorous life and healthy teeth seem to be going together. Whether there's complete scientific backup or not is beside the point, but the point is apparently that people who have good teeth on an average can be observed to be healthy and long living. Is that true?
That is true. Your observation is dead on correct and very accurate. Just for example, both of these ladies, the reason why they're so healthy is that their mouths are also truly healthy. They're disease-free. They come in and have their maintenance done and keeping up with their own home care. And I think that is their secret to being able to have such great longevity in their lives.
Yeah.
And especially being comfortable. Mm-hmm.
Right. Yeah, it's not only about adding years to your life; it's about adding life to your years. Yes, and you gotta be still alive, so to say. Otherwise, what is it worth? And you have mentioned in other videos, which about the devastating effect of gum disease and stuff, how that affects the rest of the body, and how you doctors keep finding, not just you dentists, but the doctors, the surgeons, keep finding more and more. Their link and their relationship that an infection in the mouth is about as bad as it can get. Anyway, how did you become a dentist?
I became a dentist primarily because of the fact that when I was a young child, I was at my grandfather and grandmother's store, and I was able to get into their candy cabinet. And so I would go in there and take the candies that I'd like, go to a corner in the store, hid there, and enjoyed all of the sweets that I was able to take off with. Because of that, I had to go see the dentist many times. And so in the process of seeing the dentist and being there so often, I was able to observe what the dentist was able to do for me. I did have my share of these silver stainless steel crowns, and just watching my dentist create those and fit those to my teeth, I thought, oh, that looks so artistic. And so because of that led me to want to become a dentist, because since I was in the chair so often, I thought it would be my opportunity to try to do the same thing and to help others. And because of my dentist, who was a children's specialist, he was able to help me to stay comfortable, and I wanted to do the same thing for others.
I mean, that is a story I have never heard yet. I was able to I grew up in a candy store, and yes, the teeth did suffer. I had my share of fillings and crowns, and at that time they were not as beautiful ceramic as now. I mean, did make them, but they were too expensive at the time to do so. So it was made with silver, and I got fond of the dentist helping me out all the time. It's like, my God, that that is incredible. That is incredible. Is that the equivalent of like, mommy always gave me money and lent me money, so I became a banker, or what?
You might think so.
Wonderful. Well, absolutely incredible. Well, Dr. Fong will talk more about some specific and particular dental problems and dental habits and see whether we can learn something. Thank you very much.
You're welcome.